think we can no longer look away from the reality of monkeypox. After the World Health Organization alert, it's key to understand the dangers of the virus, how it spreads, what it should do. We've got some of India's finest virologists and experts with us. Dr Gagandeep Kang, professor at the Christian Medical College, Vellore, is with us. We're also joined by Dr Suresh Kumar, the MD of LNJP Hospital, where a patient who's contracted monkeypox in Delhi is being treated, and Dr Rakesh Maria, the director of the Tata Institute for Genetics and Society in Bangalore, joins us as well. Thank you all very much. Firstly, Dr Suresh Kumar, what is the condition of the patient who's contracted monkeypox in your hospital?
This gentleman was admitted with us 2 days back, and the sample was sent to NIV Pune, and we got the report today. And right now the patient is stable. His pulse, blood pressure is fine. His temperature is normal, and he's doing very well, recovering very well. And we hope that everything goes on smoothly.
Dr. Kumar, what were some of this patient's symptoms?
He was admitted with history of fever. Prior to admission, he had history of fever for 5 days, and then he had skin lesion. First eruption was seen in the lower limb, and then abdomen and thorax, and then upper limb, and gradually palms. They were also having a typical monkeypox lesion. And initially, he was just suspected case of monkeypox, and then we thought that we must send the sample for virology, and the sample, we got the report today that it's positive. So right. Based on the clinical diagnosis and laboratory, which is gold standard PCR test,
sure,
he is a confirmed case of monkeypox.
So Dr. Kang, a few basic questions. I think the basic question on everyone's mind is, how dangerous is this?
Well, the strain of monkeypox that is circulating around the world at the moment is one that has a relatively low case fatality rate. It is a strain that in Africa has about 3% case fatality, but when it has infected people around the world, where healthcare is in general much better, the rate has been much lower than that. It's been 5 deaths reported so far out of 16,000 plus infected individuals. And most often when deaths do occur, they tend to occur in very young children or in people who have significant immune compromising comorbidities such as HIV.
Dr. Kang, just a broader question. As a scientist, researcher, looking at this, how worried are you personally about what we see now and concerns about mutations if this spreads further?
Well, for one thing, it's a virus that is not an RNA virus, so you should not expect too many mutations to accumulate too quickly. You cannot relate this to what we have seen with SARS-CoV-2. Nonetheless, it is a public health concern because prior to this, the outbreaks were relatively limited and many of them were traced back to an animal to human spread. What we are seeing now is clearly human to human spread, and that's why we should worry and put in place public health measures. But this is not a virus where even though it spreads through the respiratory route, most often the respiratory spread happens when people are symptomatic. So if we are aware of symptoms, if we track travel histories, if we track contacts of people who are known to be infected, make sure that they are isolated, or when and if we have vaccines, provide a ring vaccination strategy, I think we should be all right. It's something to be watchful about, not something to be scared of.
Dr. Mishra, how does it spread?
Yeah, so as you just heard Professor Kang telling that it spreads through close contact with the people. In fact, it requires very close contact. You have to be talking to the person without any protection for quite some time, or have close skin contact cuddling, kissing, or anything further. So that means that is not like SARS-CoV-2 that through aerosol can spread in a crowded place. You have to really get close exposure, and that's why it's not going to be something that big that we have to worry so much. But as you just heard, it is a public health concern, and therefore we have to take care. And it's not something new. It's known for quite some time, and unlike RNA virus, is not going to have variant every now and then. So it's going to be much simpler. And although most of the infection what we see are human to human, but it's also a zoonotic virus, and animal trade and those things can cause a problem, and one has to be watch out for them. But while we have to be careful, there's nothing really to panic or worry so much about this.
Dr. Kang, one of the reasons why the WHO announced this worldwide alert yesterday is because they felt there's a lot about the virus which we don't know. What is it that we don't know?
Well, one basic thing that we don't know is why is it now spreading with much more human-to-human contact than it did before. It's not like human-to-human infections didn't happen previously, but those tended to be much more limited outbreaks. Now we are seeing spread on a scale geographically and in terms of numbers that hasn't been seen before. So understanding why that is happening is important. Is it because something has changed in the virus? And the sequence data does not seem to indicate that that is the case. Or is it the behavior of human beings that is different and allowing for this to spread unchecked? Well, that is something that can only come once we understand the network of social contacts that infected individuals have had. There are some clues already about how spread happens, particularly with large gatherings and with sexual behaviors which were not previously identified before. But it is important to emphasize that this is not limited to just those groups that are at highest risk, even though they may be responsible for the greatest amount of spread.
Dr. Kumar, based on treating the patient you are treating right now, has there been any progress in terms of finding the roots or how this individual got infected in the first place? We made this effort during COVID. Somewhere down the road, it didn't really work out. But are we any closer now to knowing where this patient contracted?
Our team is on the job for contact tracing, the detail of the visits of this person, because there is no international history in these patients. The 3 patients which were reported from Kerala, they have the visit to the Dubai or other countries, but this case particularly, no history of any international travel, but this has only domestic travel. So the places where he has visited in previous 2-3 weeks, we are doing all necessary contact tracing, and this is very important. And these patients' symptoms are also very classical, very typical. The typical skin lesions, typical prodromal features, then fever, then the eruptions of skin lesion, and then now he is in the recovery phase.
Right. Dr. Mishra, is there a vaccine that can fix this?
Yeah, there are, I guess, 2 vaccines approved by the FDA that can be used to prevent the infection by this virus. But I don't think they will be available at very large quantity. So depending upon how it goes, that can be accelerated. These are all whole virus related vaccines. So it will take a little while to make them in larger quantities. But vaccine is there. And those, I understand that the people who have been vaccinated for smallpox, they are also protected to some degree because it's very closely related virus. So vaccine will be available actually for this. And I think we don't need such a huge vaccination drive for this. We need to give to people who are more vulnerable, like healthcare workers and so on, or if somebody is feeling that they may get exposed to this. So that should not be so much of a problem in that case.
Dr. Kang, isn't it also true that infants or very young children in the United States have been infected as well? So it does affect kids as well, right?
It does. And actually, we need to worry more if children get infected, because what we know from prior outbreaks is that the chances of mortality are greater in the youngest in the population.
And again, in terms of specific precautions, Dr. Kang, what should one be looking out for? How does one, we wore masks and we continue to wear masks often to fight COVID or to avoid COVID. What sort of precautions should we be taking here?
It's actually quite odd that masks and the hygiene measures that we had in place, the avoiding of direct contact, as well as making sure that you clean your hands regularly, are ways of preventing infection if you are in contact with somebody who has a monkeypox infection. It spreads through the respiratory route, for which masks help, and it also spreads through contact, for which hygiene and making sure that you're not in close contact with an infected person also helps. It's also important to watch out for fomites or objects that may have been touched by a person who is infected, or if any of an infected person's bodily fluids have come in contact with any object that is lying around, including things like towels and bedding, which should be cleaned properly.
So a basic question, Dr. Kang, basically, if you've come in contact with somebody who may have the infection, the worry is that from your hand, for example, it may enter your system through your nose or your mouth. Is that right?
Well, it's a virus that can be acquired through skin-to-skin contact. It can be acquired through the respiratory route. And if you do a hand-to-face or a hand-to-clear area of skin, right, you're actually setting up for the virus to be able to establish an infection there. You definitely don't want to get oral lesions if you can avoid them. So making sure that your hands are washed is really important. I think the stage that this is at, the other routes of transmission, which are largely animal to human, these don't apply as much, but it is something for us to be aware of, that this doesn't necessarily come only from monkeys, but is an infection that can be transmitted by rodents, and some rodents may not have symptoms during the time that they are infected.
Dr. Kumar, one final question to you. Other than the skin, firstly, at what stage do the skin lesions start appearing, and what are some of the other symptoms which come prior to or after the lesions appearing?
You see, the incubation period of this DNA virus, monkeypox virus, is 6 days to 13 days. But in some rare cases, it can vary from 5 days to 21 days. So after the incubation period, with the contact with the primary or the infected person, one can have the symptoms. And first, fear appears, and after 5 days of fever, then you have the skin lesions appearing in the various crops. And you have this different type of lesion. You can have the umbilicated lesion. You can have the vesiculo-pustular lesion in the skin, which are highly infective. And once these skin lesions are crusted and they are peeled off, after that, the patient is no longer infective. So means that once you have the typical symptoms, the man is infective 2 days prior to the symptoms and 2 days after the disappearance of the skin lesions. That is very important. And the skin lesions appear in the different type of, whether it is a sexual contact or skin contact, or you have the droplet infection. That depends the primary source of infection and the mode of transmission. Any body fluid, this virus can be there, even in the saliva, even in the skin lesion, even in the urine. and in the various body fluids.
All right. Well, I'd like to thank you all very much for, spreading knowledge, which is what we try and do with these discussions. Hopefully, we won't have too many more conversations on monkeypox, but we need to be ready to face this head on. I'd like to thank you very much for being with us. My colleague Priyanshi's got a few more details on what's being reported around the world.
Monkeypox cases are rising in India and abroad. The fourth Indian case of monkeypox was reported in Delhi, and it adds a peculiar worry to our overall picture. Let's tell you why. The last three cases that were reported from Kerala all had a previous foreign travel history. They had a travel history linked to the United Arab Emirates, but the Delhi monkeypox case has no foreign travel history. Now, this is raising concerns, with experts saying that this means we now need to contact trace more, meaning that the disease is not just coming from international countries, but it's also spreading within our country itself, which is why we need to contact trace more. Now, if we get you an overall global picture, over 16,800 monkeypox cases have been reported globally, and 4 monkeypox cases have been confirmed in India. The monkeypox cases are reported in 74 countries globally. The World Health Organization has declared that the monkeypox outbreak is a public health emergency, and this is the highest alarm that the World Health Organization can sound. Now, this raises lots of questions. We'll tell you all the important facts about monkeypox that you need to know. Number one, what really is monkeypox? As per the World Health Organization, it is a viral disease from the family of smallpox. Now, where does the name come from? The outbreak was first discovered in colonies of monkeys that were kept for research. The name doesn't mean monkeys are the source of the virus. In fact, the source of the disease is still unknown and still under research. Now, an important concern is how lethal is this virus? Monkeypox infections are rarely lethal. 3 to 6% of patients unfortunately die of the virus as per WHO, and people with weakened immune systems are more likely to get seriously ill or unfortunately lose their life. But on the disease overall, the symptoms last from 2 to 4 weeks on average. But what are the symptoms is the next question. Fever, headache, muscle aches, swollen lymph nodes, chills, rashes that can look like pimples or blisters that appear on the face, inside the mouth, and on other parts of the body like the hands, feet, chest, those visuals of those blisters that we've been seeing. Now, the next question is, how does monkeypox really spread? Well, 2 ways. It can be a human-to-human transmission or an animal-to-human transmission. First, let's get to the human-to-human transmission. Direct contact with infectious rashes, scabs, bodily fluids, respiratory secretions during prolonged and face-to-face contact or during intimate or physical contact such as kissing, cuddling or sexual intercourse is also a source of transmission. Number 3, touching items such as clothing that previously touched an infectious rash or bodily fluids are also another source. Now, pregnant people can also spread the virus to their fetus through the placenta. But studies say that the majority of cases are transmitted via sexual activities. A study by New England Journal of Medicine says that 95% of monkeypox cases are transmitted via sexual activity. Now to the animal-to-human transmission. Contact with infected animals, either by being scratched or bitten by the animal or by preparing or eating meat from infected animals, is also a source of transmission. Now, one of the most important questions. How can you save yourself from monkeypox? Well, number 1, avoid close contact with those who have a rash looking similar to that of monkeypox. Number 2, maintain social distancing to save yourself from respiratory or touch transmission. Number 3, avoid touching unwashed bedding, towels, clothing of an infected person or somebody who you might not know, because you never know, they could be infected. Number 4, wash and sanitize hands very often to maintain cleanliness and hygiene. And number 5, to prevent animal to human transmission, make sure that all meat you eat is thoroughly cooked before eating, and avoid any unprotected contact with wild animals. Now, as an ending note, experts say that for now there's nothing to panic about the spread of monkeypox in India, and if we follow the precautions and contact trace at this time, we'll be able to control the disease before it gets out of hand.